Billings voters coming to the rescue of fire, police, and public safety services, passing a public safety mill levy for the first time in 16 years.
We have the results, and we won.
Plenty of excitement at the home of the mayor, where city staff and council members gathered to watch the numbers roll in. Well, voters showing overwhelming support for the levy this time around, even though it will tack on more money to property taxes. 20,511, or about 67%, voting for the levy, and 9,818, or 33%, voting against it. That levy repeals and replaces the old levy, which passed in 2004 and was capped at $8.2 million. The new levy will be calculated at 60 mils. Now, if you're wondering how this affects you as a homeowner, it'll add about $4.75 a month on to a home with a median value of $211,000. The new levy will generate an estimated additional $4.12 million in funding, about $12 million in all, and allow the city to maintain current levels of service for now as emergency calls and crimes continue to increase in Billings. City officials and many residents breathing a little easier tonight after getting word that the levy had passed.
I'm very relieved that tomorrow morning I can go to work and we can set ourselves to taking care of the things that are really plaguing the city, the violent crime or methamphetamine, all the issues that affect our quality of life and livability, as opposed to trying to figure out how to deliver service in the shadow of a $2 million deficit.
And so this is very, very sweet. It's also a bit sober because our greater needs for more police officers, more firefighters, more 911 operators and prosecutors, and space for all of them haven't gone away. We still need all of those things, and so it's probably inevitable we're going to have to come back to the voters at some point in the near future to ask whether they will approve even greater spending.
Well, this levy will help the city with its 2021 budget, but that budget also includes $750,000 in cuts split between the police, fire, and parks departments.